Hi guys, welcome back. My name is Kweku. I'm a pharmacist. Today I'll be reviewing the medication Venlafaxine. In the next few minutes, I'll cover what Venlafaxine is, how it works, proper dosing, side effects, and crucial safety information that I believe you need to know. Now, as a quick disclaimer, this review is just for informational purposes only. Please do not stop, or make any changes to your medication regimen without first talking to your doctor. So let's start with the basics. What exactly is Venlafaxine? Well, you might know it better by the brand name Effexor or Effexor XR. Now, Venlafaxine belongs to a class of antidepressants called SNRIs, which stands for serotonin, norepinephrine reuptake inhibitors. Now, this puts it in a different category than what most people are familiar with, which is the SSRIs, which only affect serotonin. Now, Venlafaxine is FDA approved for treating major depressive disorder, generalized anxiety disorder, social anxiety disorder, and panic disorder. The extended release version, the Effexor XR, is approved for all these conditions, while the immediate release version is only approved for depression. Venlafaxine may also be used off-label for conditions like fibromyalgia, diabetic nerve pain, migraine prevention, hot flashes, and PTSD. Now, what makes Venlafaxine unique is that it affects both serotonin and norepinephrine, two important brain chemicals that regulate mood, anxiety, and pain. This dual action can make it particularly effective for people who haven't responded well to SSRIs alone. Venlafaxine has been around since 1993, so it's well studied and available as a generic medication, making it relatively affordable for most patients. Now let's talk about how Venlafaxine works in your brain. So Venlafaxine works by blocking the reuptake or reabsorption of two important neurotransmitters, like I said earlier, serotonin and norepinephrine. Now, these chemicals are messengers that carry signals between brain cells. Normally, after these messengers deliver their message, they get recycled back into the cell that released them. Venlafaxine blocks this recycling process, which means more serotonin and norepinephrine stay available in the space between brain cells where they can continue working. Now, here's what's interesting about Venlafaxine. At lower doses, it primarily affects serotonin, similar to an SSRI. But at higher doses, it also significantly affects norepinephrine. This is why some people who don't respond to SSRIs may find relief with Venlafaxine at higher doses. So this increased availability of these neurotransmitters helps improve mood, reduce anxiety, and can even help with certain types of pain. It also promotes neuroplasticity, which is your brain's ability to form new connections, which is important for long-term recovery. Now, it's worth noting that Venlafaxine typically takes about 4 to 6 weeks to show its full effects, though some people may notice improvements in sleep and energy within the first 1 to 2 weeks. Now, let's talk about how to take Venlafaxine properly. Venlafaxine comes in immediate release tablets and extended release capsules. The extended release version, the Effexor XR, is typically taken once a day, while the immediate release version is usually taken 2 to 3 times daily with meals. Typical starting doses may range anywhere from 37.5 to 75 milligrams daily. Now, your doctor would typically start you on a lower dose and gradually increase it over several weeks to find the right dose for you. The maximum recommended daily dose can go up to 225 milligrams for most conditions. Now, taking Venlafaxine with food may help reduce some of the stomach upset that it is noted for. For the extended release capsules, swallow whole, don't crush, chew, or break them. If you can't swallow the capsule, you can carefully open it and sprinkle the contents on a spoonful of applesauce and then swallow without chewing. Best practice is to take it around the same time each day, kind of maintain steady levels in your blood. Now, if you're taking it once daily, you can take it in the morning or evening, whatever best suits your schedule, as long as it does not interfere with your sleep. Now, let's cover some critical safety information that could literally be life-saving. First and most important, Venlafaxine carries a black box warning about increased suicide risk, especially in people under 25 years old. Now, this risk is highest during the first few weeks of treatment or when doses are changed. If you experience any worsening depression, suicidal thoughts, or unusual mood changes, please contact your doctor immediately. Venlafaxine can also raise your blood pressure, especially at higher doses, so your doctor will monitor this regularly. If you have heart disease, high blood pressure, or glaucoma, make sure your doctor knows about this before starting the medication. For pregnancy and breastfeeding, venlafaxine can cross into breast milk and may affect a developing baby also, so especially in late pregnancy. So always discuss the risks and benefits with your doctor if you're pregnant or if you're planning to become pregnant. Another important precaution is to avoid alcohol while taking venlafaxine, as it can increase drowsiness and may interfere with the medication's effectiveness. Now here's another crucial fact. Do not stop venlafaxine suddenly. This medication is known for causing particularly severe withdrawal symptoms if stopped abruptly. Your doctor would need to gradually reduce your dose over several weeks when it is time to discontinue. Now let's talk about some common side effects that you might experience with venlafaxine. Being prepared means that you're better able to manage them should they happen. So the most common side effects reported include nausea, dizziness, drowsiness, dry mouth, constipation, sweating, and trouble sleeping. Some people also experience sexual side effects like decreased interest in sex or difficulty reaching an orgasm. Now, with that said, nausea is probably the most common complaint, especially when starting the medication. Taking it with food can sometimes help alleviate this nausea. Some people also experience what has been described as brain zaps, which are like brief electric shock-like sensations, especially if they miss a dose. Now, talking about sleep can be affected in different ways. Some people feel drowsy while others experience insomnia. So if sleep problems persist, obviously talk to your doctor about adjusting the timing of your dose. Now, most of these side effects for most people tend to be mild and often improve within the first few weeks as your body adjusts to the medication. The key is not to stop the medication without talking to your doctor first. They may have suggestions about how to manage some of these side effects, or there may even be a need to adjust your dose. Now, let's discuss some serious side effects that may require immediate medical attention. Now, these are the ones that are less common but very important to recognize. Serotonin syndrome is a potentially life-threatening condition that can occur, especially when venlafaxine is combined with other medications that also affect serotonin. Warning signs include a high fever, a rapid heart rate, muscle rigidity, confusion, agitation, and excessive sweating. This you would usually require emergency medical care. Venlafaxine can also lower your seizure threshold, particularly if you have history of seizures or brain injury. If you experience any seizure activity, needless to say, stop the medication and contact your doctor immediately. Now, some people may also develop abnormal bleeding or bruising, especially if venlafaxine is combined with blood thinners or other medications that make you prone to bleeding, like NSAIDs, aspirin, ibuprofen, naproxen, that class of medications. Now, remember that while these side effects, sound scary, they are very uncommon when venlafaxine is used appropriately and monitored properly. The key is knowing what to watch for and getting help if needed. I sincerely hope you found some value in this video. If you did, please share with somebody else. As always, stay blessed and I'll catch you on the next video.